This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
Real Talkers, this episode is going to act in a way as back-to-back follow-ups on a couple of conversations we've had on the show in the past while. Grateful to have you here. If this is your first time catching us, maybe you're joining our live stream presented by California Closets. Maybe you're watching from Ontario because Dr. Andrew Boozary is joining us. We want to welcome you. If you're joining us from anywhere else in Canada, we probably don't have to tell you that ER wait times are a real problem, most particularly in Canada's big urban centers, but across the country, Canadians are reporting waiting for hours for care in many circumstances, including here in Alberta, as was revealed by way of a leaked document that we shared with you on the show just last week when we talked to Dr. Paul Parks, past president of the AMA. There have been crisis situations, dozens of critical near misses, and at least 6 people dying, waiting for emergency care in Alberta hospitals. It's something that's waking up governments, of course, or at least that's what members of the public hope, and frontline workers are taking remarkable steps, speaking out, taking professional risks, talking about what's causing these hours or days-long waits and what needs to happen to fix them. In this episode, we're going to talk to Dr. Boozary about a model that he dreamed up. He conceptualized Dunn House, an innovative and permanent housing solution in Toronto at one of the nation's busiest hospitals. And just a few days ago, it's been announced that that program will double in size and scope based on the return on investment, the proof of performance. We're going to find out what's working in Ontario. We'll stack it up against that bridge healing program that we talked to you about back in November. You remember when Dr. Louis Francis Cuddy was one of the members here on a Real Talk Roundtable, and we talked about what they're doing at the Royal Alexandra Hospital in Edmonton to try to address those wait times as well. The Royal Alex, I probably don't have to tell anybody in the Metro Edmonton region nor across Alberta, one of the busiest hospitals in the country, and a hospital that is seeing reports from triage nurses and other frontline workers that are speaking out that the ER waiting room is oftentimes at double capacity. We're talking 110, 120 people in that ER at a time waiting for care. We're seeking for solutions in this episode of the show. On the back nine, we're going to talk to Blaise Boehmer. You may recognize the name. If you do, you're probably a political nerd, a political geek, a like-minded spirit with the host of this show. And this is the home for political nerds and geeks. Blaise Boehmer was a senior staffer for Alberta Premier Jason Kenney, and he was there when the Kenney government introduced recall legislation that's being torqued right now, that's being utilized in a couple of dozen ridings across the province of Alberta as citizens have their sights set on Alberta MLAs that they say deserve to lose their jobs. Well, Blaise says, and his position is, that the recall legislation was a mistake from the outset. Keep in mind, he was in the office that wrote it up and made it law, and he's going to explain to us why he says he disagreed with it from the beginning. That's coming up in this episode of the show. Let's get to Dr. Boozary in 30 seconds. First, I want to let you know this episode is happening with the presenting sponsorship of our friends at Hanson Distillery. This is Edmonton's original distillery, rooted in prairie grit and a rebellious spirit. Hanson's known for authentic small batch whiskey, vodka, gin, moonshine, and unique liqueurs like this oat milk cream liqueur you're seeing on our screen right now. That's hansondistillery.com. Everything is crafted right here in Alberta's capital with local Alberta ingredients, and every bottle tells a true story of passion, heritage, and hands-on craftsmanship. So we invite you to raise a glass to Real Talk, raise a glass to real spirits. You can visit Hanson Distillery on 174th Street, 111th Avenue. They've got their famous Northern Eyes 5-year aged whiskey. And if there's any bottles left, they have their 7-year aged whiskey as well. This is the first time a 7-year aged whiskey has ever been released by an Edmonton distillery. You can find Hanson anywhere you buy fine Alberta spirits. It's proudly local, always original, made right here. Let's get to our feature interview presented by Mercedes-Benz Edmonton West. Dr. Andrew Boozary is a primary care physician, a policy practitioner, a researcher, and the founding executive director of the Gattuso Centre for Social Medicine at Toronto's University Health Network. He's also the force behind Dunn House in Toronto, a supportive permanent housing model that integrates healthcare and housing under one roof. It's wonderful to have you joining us here on the show, Doc. Thanks for making time for us, and welcome to Real Talk.
Thanks so much, Ryan. I know we've been trying to find the time, so really honored to be here with you today.
Yeah, well, I think that your CV and your professional experience provides the credibility. I'll let the audience know. We've been trying to book you for a few weeks now, but you've been on the road, you've been speaking, you've obviously been working double duty in Ontario with Dunn House and everything else that's keeping you busy. This is a model that you dreamed up a relatively short time ago. Talk to us about maybe the grassroots of Dunn House, how you got to that point, and ultimately what you pitched.
Yeah, I think that the realities are that we just have to be clear about this connection between homelessness and health, because it may seem odd as to why a hospital or the healthcare system is so connected or invested in seeing better outcomes for people who are unhoused. The realities are that for people who are chronically homeless, and we're seeing this at a scale we've never seen before, Ryan, in Canada. We see the fact that, again, when you look across various jurisdictions, people who are unhoused, people who are chronically homeless live half as long as the general public. So that can be 20 to 30 years, really where I feel that's unconscionable. And that's why we see homelessness as the most powerful social determinant of health. And when we started at UHN just around 7 years ago now, I still can't believe it's been that much time coming through the pandemic. When I looked at our own data, it became very clear that there are around 50 to 55 patients that made up over 4,000 emergency departments in a year. And again, that's not because people want to be in the emergency department. In many cases, they have nowhere else to go, or their healthcare conditions, which could have been treated in a primary care setting or upstream, end up worsening and exacerbating to a point where they have to present to an emergency department. And in many ways, they become admitted and also spend a lot of time and languish in hospital beds, where we also know some of the conversation you've been having, the real challenges with hospital bed capacities in Alberta and Ontario, and really across the country. So this is a wicked problem that has real health ramifications, human dignity implications, but then and also sound health economics. When you look at the ancillary costs of us not doing something or not bringing solutions to this problem that really is quite pervasive across the country.
Doc, I'm sure you're familiar with Dr. Brian Goldman. He had interviewed two triage nurses, two triage RNs at the Royal Alexandra Hospital in Edmonton a short time ago. And I shared his interview here by way of X over the weekend. And I noted that firefighters have told this show that the ER at the Royal Alex is consistently at double fire code occupancy. They're saying about 120 people in the waiting room at the time. And here's the question for you, and I'm just going to read real life or at least social media responses to this, and they're going to sound harsh, but I want to ask you to respond. I want to get to the root of the issue here, but if you can see the response to this, like Barb responds to me and says they need to get the homeless out of there and keep them from coming back. Others are saying that, this is Mary says that ERs are acting as a homeless shelter. Others are saying this is what happens when you invite more people than you can provide services for, and then you don't have the power to look after the situation. Literally nothing you can do. Jim says immigrants and drug addicts are abusing the system. Patsy says the homeless are filling it. Nick says that I used to be a respected media person, but now I've turned into a virtue signaling talking head for the socialists. And Truth Project is wondering, how many homeless people and immigrants do I have living in my house, or am I just another virtue signaling clown? So we don't see a lot of empathy in the replies, but I wanted to ask you, how significant is the issue of the unhoused population utilizing ERs for healthcare, along with Canada's influx in population? What are you seeing?
Yeah, and I appreciate the candid comments that you scrolled through. I think the realities are nobody likes the look of encampments. Nobody likes the idea of where people having to resort to public transportation during this polar vortex here in Ontario or during the winter in various parts of the country. But I think we have to flip the onus that we've been putting and casting on individuals as some sort of personal failure. So let's be really direct and clear about the data. We now have less than 3% of all housing builds and all housing investments are in social housing. And that was not the case 30, 40 years ago. And at 3%, we're actually at half the rate or at half the level of OECD countries. So we are lagging behind when it comes to access to social housing. And what does that mean on the ground? That means here in Toronto, that's an 8 to 10 year wait list to get into housing. So when my colleagues and I say that homelessness is a terminal condition, it's not to be virtue signaling or to be sensationalist. The realities are that many patients I see in the shelter system pass away before their number is called. And that becomes, again, then a reality of where people are seeking shelter or help or support in emergency departments when there is such a wait list, when there's shelter capacity issues that really mirror the hospital bed capacity issues. And this is why I argue you can't really disentangle the shelter bed crisis from the hospital bed crisis. And again, if it's not about empathy or human dignity, if that for some reason is not compelling enough for us to do something, then let's look at the health economics. It's over $50,000 a month for someone to be in hospital. It's around $14,000 to $15,000 per month in the jail system. And a dear colleague of mine, Lana Fredo, calls it the de facto mental health system. Again, we could talk for a whole episode around the challenges in accessing mental health care and what that means now for the justice system and for some of the outcomes. And then it's around $6,000 a month for the shelter system. So supportive housing is really, and social housing is a fraction of the cost, at less than $4,000. And so this idea that we continue to cast blame when it's been chronic policy decisions and investments playing out across partisan stripes over many decades, I think we really have to upend and cut through some of the noise when it comes to this false debate around the fact that really this is just people preferring or wanting or pouring into the emergency department because they want to be in the waiting room.
We've got Erica here in our live chat, powered by Park Power, and she says, we know to a certain degree what's causing ER wait times here in Alberta. She says, but if this is an issue, basically nationwide, what are we doing wrong across the country? Doc, do you see like consistent shortcomings or do you see consistent policy or practice failures like from BC all the way through the Maritimes?
Yeah, when I visit Vancouver, I think the problems are rife, and you're seeing this in Alberta, Manitoba, and again, been hearing about some hope and major initiatives all the way on the East Coast, looking at trying to see various ways or solutions to address this in a more sustainable, humane, and effective way. And I think that's where, coming back to this conversation around Dunn House, which you see here in terms of the tenants and the Fred Victor team, which is the nonprofit operator with UHN, is around dedicating a parking lot. So it was a public parking lot under UHN property that was donated to the city or leased to the city for $1 over 49 years that helped unlock these federal, provincial, and municipal investments to have 51 homes for some of the individuals I mentioned that were in this doom loop in and out of the emergency department, or this vicious cycle that also imposes, to be really clear, a lot of moral distress on colleagues who know that they can only, whether it's nursing, social work, or physician colleagues, that they can only provide Band-Aid solutions and that it's not interrupting this cycle in a meaningful way. So I hope, again, that this provides a playbook or a template that we can do things differently from a healthcare perspective, but even for civic institutions, other public institutions. And again, really needing to see this coordination of the federal, provincial, and local governments looking at more effective solutions than either trying to police poverty or continue to perpetuate this shame and stigma facing people in emergency departments who are either homeless or use drugs. And then there was another comment I just want to make sure that I address, is that there's also been this idea of conflating substance use or mental health as the primary and sole drivers of the homelessness crisis. Again, from the data, that is bunk. The realities are, again, we've got 8 to 10 to 12 year wait lists for social housing. We have social assistance rates that have not kept up with any standard of living, even at the lowest of margins, that people are forced to try to survive. And when we talk about, is this an issue across the country? fundamentally, yes, when you look at the realities that, this has been impossible choices for families, for people, from whether it's paying for groceries, paying their rent, or renewing their medications. And this is a major driver towards homelessness, towards more precarious housing. And from my vantage point as a clinician, terrible outcomes that are preventable.
We've talked to doctors that have described a moral distress that they experience when they're discharging patients from ER, in particular in cold climate, knowing exactly what's going to happen. I see some comments here in our live chat. There's empathy in this live chat, maybe one of the only live chats in the internet driven by empathy, but we've got it. Scarlett here says the homeless need somewhere to go. I mean, Sneezies is reminding us in the live chat how personal this is for people. Says my brother lost his life while he was making efforts for housing. Ms. KD says, yeah, all the chronically unhoused who end up with amputations are sure abusing the system. Give me a break. I mean, I know that people, members of the public, want to see this solved. Was there something, or maybe several elements of Dunn House and the model that you not just conceptualized, but have rolled out and now seen support doubled for a recent announcement, which we'll get into? Are there principles, practices there that you think could be applied to hospitals and health authorities across the country?
One, Ryan, it's about how do we leverage the resources that are here to address this very acute and chronic crisis that has been playing out for a long time. And, unfortunately, it is tragic of hearing these stories that are not unique to a select few, but thousands of people, of where we see, again, higher death rates and mortality rates for people who are unhoused. And this means the grief of family members, of loved ones, again, on something that is really preventable. And when you look at a medical intervention or a drug that may have been able to restore 10 or 20 years of life years, you would think every funder would be tripping over themselves to make sure that this got to market or reached people. We have that treatment. We have that solution. It's housing. And so really from the perspective of healthcare institutions, how can we leverage the land or work with others who have public land to see more housing options come into play and that are actually permanent for people, that they're sustainable? We've, in the Toronto context, being able to move people from hospital into a housing environment that may only be there for 30 days or 60 days is not really tenable because, as I mentioned earlier, there is no path even to the shelter or other housing options. So we really need to make sure that we've got permanent solutions. There are sustainable solutions. At Dunn House, people hold a lease like you or me. They pay for their rent through many various ways, but it is about the supports as well. So we can talk a lot about the importance of housing, the structural elements and the solutions of housing, but the wraparound supports are vital. And that means, again, working and partnering with Fred Victor around the 24/7 casework support that's there, having nurse practitioners, community health workers, physicians and psychiatrists, mental health and addictions, Indigenous health program partnerships, all there to help people as they may need or choose in redefining their own health and well-being. And I think this is something that we see from the evidence and from this body of literature and body of work, that the supports are really crucial. And of course, we can't be having this debate around people's health and well-being or even around universal health care when hundreds of thousands, tens of thousands of people in Ontario, it's now closer to 100,000 people in Ontario, are homeless. So we really have to address this in a myriad of ways. One solution like Dunn House or 51 or 54 new units, now we'll have 105 cumulative, is not going to end the homelessness crisis, but hopefully it can spur more of this action across the country to see this social medicine housing model start to take some hold.
We're talking to Dr. Andrew Boozary out of Toronto in our feature interview presented by Mercedes-Benz Edmonton West. I want to jump into our live chat. Christine says, I'm crushed and disgusted with some of the comments that Jespo just read. These people ought to be ashamed of themselves. She says Dr. Boozary's a hero, by the way. She says your research second to none. Says we need versions of Dunn House across Canada. Goramut says on the immigration file, says I've seen almost all immigrants working when I've been in hospitals. Some Canadian-born nurses, sure, but many have come to Canada relatively recently to help and be wonderful contributors to our society. Scarlet B is pointing out in Alberta, you need an address to receive social assistance. I had no idea about that. And Denis is wondering why in the richest province, talking about Alberta, do the hospitals have to run raffles to improve their delivery of healthcare? Doc, I want to cite reporting just within the last week here, this at cbc.ca around your program, and the University Health Network, don't have to tell you, is doubling the housing program, doubling the Dunn House program that's reducing ER visits. I referenced the proof of performance. It's incredible. Data shared with Canadian Press shows that the 48 residents who live at Dunn House had made nearly 2,000 visits, 48 folks, 2,000 visits to an ER the year before moving in. A year later, those same residents visited ERs 52% fewer times and saw a 79% drop in the length of stays when they were admitted. It's caught the attention, obviously, of the federal housing minister, former Vancouver Mayor Gregor Robertson, who said that this is a program that needs to be scaled up across the country. So you're seeing funding from the feds. The province of Ontario is going to pay for the operating costs, or at least a portion of them. And we're seeing Toronto Mayor Olivia Chow there now, who's spoken about the importance of this as well. Was there heavy lifting that you needed to do on, I guess I'll call it the lobby side, to get all three levels of government working together? We don't see that all the time.
I think that's part of the advocacy. And again, it was so heartened to see the commitment from the Minister of Housing, from the CEO of Build Canada Homes last week, of really speaking to social medicine housing as a real path forward for the country, and the provincial level, the Minister of Housing, Minister Flack, again, I think highlighting the importance of supportive housing and wanting, I believe, on record saying the need to scale success stories like Dunn House, alluding to the data that you mentioned. Again, when you look at the hospital bed crisis that we have, an 80% reduction is significant. And again, this is something where the outcomes are better. There's a real centering and rooting of human dignity and the opportunities for people to redefine their own trajectories. And then when you look at the local government and seeing Mayor Chow being a fierce champion for more social housing opportunities to try to prevent evictions, there's been this real alignment. And I think this is a lot of the work in terms of the advocacy of trying to help stitch a lot of this together, and seeing again where there's alignment on the mandates and the imperatives of many of the various funders, whether it's around ending hallway medicine or improving access to social housing and supportive housing. This is really, I think, the work of not only trying to help treat people who are in shelters or sleeping rough, but how do you stitch together and thread the needle around some of these initiatives that really just require some of this integration or crosstalk amongst ministries, various levels of government that just hasn't been happening quickly enough.
Dr. Shazma Mathani's in our chat right now. She's an ER doc at the Royal Alex. She also does a lot of work at the Stollery Children's Hospital in Alberta's capital. She says this is such a humane, practical, and cost-effective solution that Dr. Boozary is talking about. She says so many unhoused patients end up in the ER, which costs thousands, because of unstable housing. She says most of these visits are preventable. She goes on, by the way, to say that I think a lot of people in this live chat right now need to check their privilege. That's her prescription to our live chat for some of our live tuning audience right now. Can we take a second and let me remind myself as the host that it's not all about numbers and percentages and ER. Like, we're talking about people. We're talking about humans. Could you give us an anecdote? Well, obviously maintaining privacy and respecting the individual. Maybe a story you can think of, and maybe anecdotal evidence that you've seen of the personal impact that Dunn House has had on residents, on people.
I appreciate that, Ryan. I mean, I think this is part of the challenge with the opportunity of trying to both advocate and present as much around the lived experience and the stories, as well as the numbers and the data. And I think, again, wherever you are on that spectrum, I think there are some compelling stories, or at least evidence that can speak to why the way we've been doing things or our inaction has come at a very heavy human cost. If people haven't had a chance to read it, there's a terrific profile of Jason Miles that was covered by Victoria Gibson in the Toronto Star this past fall. And I can't think of a more inspiring, compelling story and person that I've had the privilege to get to know over the last many months and last year. And I think when you are able to dive into his story, the realities that, having suffered through some substance use and mental health and addiction issues, of being homeless, living in shelter, to now where Jason is leading recovery groups and has been appointed to the Mayor's Lived Experience Advisory Council and being able to go back to finish their diploma in high school. We see other stories of people who are in their 70s who, for the first time in many years or decades, have reconnected with family. And again, I think these are the things you can't really measure or capture. The other reality that speaks to the neglect that we've imposed on people is there are a number of people who are at Dunn House who are palliative patients. And so how do you capture the economic value of someone having the dignity to be able to pass away at home as opposed to in an encampment or in the shelter system? And so these are, again, I think the most compelling elements and why I personally do the work of seeing this day in, day out. And the more that we, I hope, can try to get this into the public discourse to help really pierce through, again, some of the vitriol that is, again, not rooted in any fact or evidence, but just really seemingly to divide people. And I think this is the way that I think our job is to resist and push back against a lot of this divisiveness with both the compassion of the stories that are here, as well as, again, the health economics that the status quo has not been working. And so people who may be listening or have been following this work may say, can we afford more Dunn houses, or can we afford a housing first approach with supports? I think my question back is, I don't know how much longer we can afford the status quo, which has failed tens of thousands of people, that has seen a higher death rate that should be conscionable in a country like Canada. And I think, again, those stories continue to be lost in various ways. And this is where I really hope that these conversations try to recenter the importance of why we're doing this and why it's not outside the lane of healthcare, and why we need to see some more effort and coordination across various healthcare institutions.
Yeah, I mean, it breaks the mold a little bit, I guess, in a wonderful way. I'm referencing a story by John Lorink in the Globe and Mail coming up on a year ago, last February, hospitals getting into the housing business. Do you think, Doc, that this model can reduce like system level pressures like ambulance offload delays or like inpatient bed shortages or long wait times in other avenues or other parts of the healthcare system?
Yeah, we've seen that data, and again, we've had Ryan, we've had a randomized control trial in this country for the Jespo Housing First program over 10 years ago that was able to show the benefits of people's mental health outcomes in being able to access housing. And for those who may not be as familiar, randomized control trial is really sort of the gold standard in medicine or healthcare to best identify, does a intervention or a treatment really work? And I think it speaks to how terrible in 2015, if not earlier, the housing and homelessness situation was in the country, that there could have been some uncertainty of trying to ascertain whether housing was a positive intervention. It was very clear that it was. The results that were published in a very prestigious American high-impact medical journal showed and continued all the subsequent studies to show that. And here we are over 10 years later with many more reports, lots of evidence showing, again, the cost effectiveness of this, not only within the healthcare system, but having spillover effects in the justice system, in, again, various ways around not only housing, but long-term care, home care, many, many elements. And, I'm also mindful of the fact that we're having this conversation in 2026. And in, preparation for a conversation, I was revisiting Malcolm Gladwell's 2006 article in the New Yorker. So it's 20 years ago on Million Dollar Murray, which, again, for people who may not have had a chance to read, I think is really informative of many of these similar issues and these spillover costs and these really tragic elements that are siphoning away life years were playing out 20 years ago. And the sensible solutions were there to ensure that housing needed to be in place. And this is probably what ended up having us, Ryan, in 2024, needing to prescribe housing because we can't keep waiting on solutions when health workers across the country are standing witness and bearing witness to the failures of public policy and social policy writ large.
Doc, I want to thank you so much for making time for us and I congratulate you, quite frankly, on the success of Dunn House to this point. I know that you're going to say that there's still a ton of work to be done, but it's momentum in the right direction. And you and the people around you deserve to be commended for that. I appreciate your time. You know, we do search for scoops as best we can. I hope you'll pardon my final question here. John Fraser has been confirmed as the interim leader of the Ontario Liberals as the party searches for a more permanent replacement for Bonnie Crombie, and your name keeps popping up as the political outsider that many people believe could be the one to defeat Doug Ford. Are you considering a pivot into politics? Is there fire where there's smoke, so to speak?
No, I think it's been surprising and really just encouraging to people responding to the work. And I think really that is where I think my name may be coming up, is I think there's a response to the realities that the way things are working is not working for far too many people. And for me as a physician, I see that in various parts of primary care and outpatient work in the emergency department. And so for me, my focus is solely on trying to continue to advance this work, trying to continue to advance these conversations. Again, I think the outreach and, it's been just really encouraging to hear this support. But really from my mind and my perspective, it's about continuing this work as a physician, as an executive director at UHN. And again, I hope there's more ways that we can get this work out into the public with more support across various policymakers.
That's Dr. Andrew Boozary. He's the driving force behind Dunn House in Toronto, the executive director of the Gattuso Centre for Social Medicine at University Health Network. A pleasure to have you on the show, Doc. Thanks for doing it.
Thanks so much, Ryan. Appreciate it.
You've got it. Real Talkers, I want to invite you to let us know what you think about what you just heard to talk@ryanjesperson.com. Most of you are going to hear this later on the podcast, or maybe you're watching it later on YouTube. You can always leave a comment there, leave a comment on Spotify, or send us an email, of course, to talk@ryanjesperson.com.
Ground control to Major Tom. Control to Major Tom.
We took our first steps, brave steps, bold steps, in 2001, opening our doors to specialized pediatric care, accomplishing the extraordinary.
3, 2, 1, lift off.
This is Major
We transplanted a heart in a newborn, implanted prosthetic ribs in a 6-year-old with scoliosis, had a stem cell breakthrough that will heal preemies' lungs. Today, we lead the nation in pediatric organ transplants. Now imagine the possibilities in a space of our own.
The stars look very different today.
Help us launch the new Stollery Children's Hospital with no bounds to what we will accomplish next for kids and their families.
You can check out StolleryNoBounds.com, by the way, for that. And a quick heads up, we will officially launch No Bounds Week, Stollery No Bounds Week on Real Talk, one episode from today. We're going to jump into our Real Talk live chat in just a second. You know that's powered by our friends at Park Power, and I want to make sure that you're on your that they're on your radar right now at parkpower.ca. If you live anywhere in the province of Alberta, our home province, and you're paying for electricity, natural gas, and internet, in other words, if you're the one in charge of the household's utilities, we want to give you a saving money solution, and that starts at parkpower.ca. I mean, here's the drill. Park Power is your friendly local utilities provider. They offer low rates, awesome service, and they share their profits with Alberta charities. What's not to like? And an exclusive opportunity for Real Talkers to save up to $150 off your first bill from Park Power. When you go to parkpower.ca/realtalk, you'll find 2 promo codes there. The more you bundle, the more you save. So if you combine electricity, natural gas, and internet with the promo code REALTALK, all one word, they're going to knock up to $150 in savings off your first bill. Johnny, you did it.
Cut my bill in half.
Worked out all right for you.
Went from around $140 to $65 a month.
Okay, and you're saying that's
incredible.
every month you cut it in half.
Every month in half.
And service, be honest. Just as good?
I mean, depends on how much you do, and I'm a guy, I think, who does more than the average bear in terms of downloading, streaming. It's more than sufficient.
There you go.
Great service.
Parkpower.ca/Real Talk. We call that a testimonial from the show's technical director, Johnny Infamous. Also some savings in store for first responders. The team at Kubi sure appreciates those firefighters, paramedics, the frontline healthcare workers, military service personnel, search and rescue, you name it, you qualify for the Powering Those Who Protect promotion. Kubi right now is knocking 5% off all solar system sales to first responders. You know, Kubi's operating across Western Canada, Saskatchewan, BC, up north, you name it, they're there as Canada's fastest growing solar installer. And that's just where the savings start. Their team is experts on tapping into government incentives and programs to make sure you keep as much money in your pocket as possible. And that's not even to mention the money that you're going to save from the power your system generates. You can learn more about solar performance in winter. I know a lot of you have been led to believe that solar panels don't work at all in the winter. There's a brand new blog post at kubi.ca. You can learn what updated solar technology, what present day current solar technology is doing. It's solar simplified and people powered at kubi.ca. And a shout out to our friends at Friesen Brothers. This is an Alberta institution. Celebrated 70 years last year, if you can believe it. Still family owned. I absolutely love it. And Friesen Brothers, of course, right now, their butcher shop, which is what this institution was built on. They started with an independent butcher shop in Hinton, Alberta 71 years ago. Well, they've got a new limited time feature this month. That's the Alberta Pork and Apple Sausage, made with local Alberta pork, Granny Smith apples. It's a tiny bit tart. I brought a pack down to Calgary to make brunch for my parents a couple of weekends ago and knocked their socks off.
Did you?
It didn't hurt that I combined it with the sourdough cinnamon buns from Friesen Brothers.
Always a crowd
Everybody
pleaser.
loves those, man. This
Don't
is
forget
a
about those
simple
pizzas.
way. The pizzas? The
I
mother dough?
would
fresh,
stuff
not
a freezer
frozen?
full if I could.
Oh my gosh. Well, I love picking them up at Friesen Brothers because they're never frozen. So you put them in the oven. It's just like the guys that spin the dough in the pizza shops. You know what I mean? Well, this pork and apple sausage available just for a limited time, but you can find more details about what's fresh at their butcher counter. Always something new when you visit Friesen.com. Blaise Boehmer coming up in just a couple of minutes. Former Kenney senior staffer, a long-time conservative, he's been involved in conservative political circles for a long time. He says that recall legislation was a mistake from the outset. We'll find out why, because he was in the office that rolled it out, essentially. I mean, obviously, a lot of conservatives aren't happy with recall legislation right now because it's targeting a bunch of their MLAs. Whether or not the recall initiatives are successful remains to be seen, but I'm looking forward to picking Blaise's brain in just a second. In our live chat, powered by Park Power, following our conversation with Dr. Andrew Boozary, Matthew Yag. Matthew, welcome to the YouTube channel membership family. I saw that Explorer Hollis made some gift memberships available in the live chat today, and so Matthew Yag's on board. He says, if you look up Edmonton's zoning bylaw podcast, he says it was a one-off project with 5 episodes. Episode 1 has a really heartwarming story about a man who overcame addiction in supportive housing. Says they started by connecting with his Cree heritage, helping him budget, giving him, providing some resources for him to buy alcohol so he could be with them more instead of panhandling, and didn't need to be drinking cleaner like Lysol, he says, or vanilla to get his fix. And then he slowly worked down the proof as part of a program, and eventually he has to move from alcohol to cannabis because he was aware that alcohol was hurting him, and now he's looking to teach Cree. Incredible story shared by Matthew Yag. Alberta Girl says Alberta may have a higher income per capita, but that does not make the province rich. Alberta Girl referencing a comment, of course, that was in the live chat a little bit earlier. It says chronic mismanagement by the Alberta government that spends public money on corporate welfare does make the province rich. Okay, interesting.
Yeah.
Cherie says when you have some people's humanity, empathy, where has the humanity, empathy, and compassion gone? Says it's pretty disheartening to see how some people are speaking about their fellow humans. That from Cherie.
I love living in Alberta. We won the life lottery, kids. If you were born here, or if you're like me who transplanted here, income, government finances, natural resources, low cost of living, low taxes, all that stuff. But I do understand there's a few pieces missing here. And one of the main ones with an exclamation point on it is just getting in to see a doctor.
Yeah.
And the things that our first guest was talking about today, some resources for people who are going through mental health and addiction problems, because they are not at all where they should be. So there are some pieces missing, and that makes people not feel as rich as we talk about, right?
Yeah, I get it. And like now you're talking about issues that are impacting the entire healthcare system, but we're looking at root causes, right? And it demands more attention to these. Cassandra, I mean, how's this for a reality check? Says, I've been living on the edge of becoming homeless for almost 3 years now. Says, I have semi-stable housing as we speak. She says, but with Alberta's government significantly reducing my income, I may find myself there again. Cassandra, feel free to follow up with details on specifically what you mean by that. MetaModern, thanks for your channel membership, says trying to blame immigrants is a dumb take. Why are we not more angry with governments who have failed to plan for infrastructure and adequate social supports? Les says 2 years ago, I was living in my van and it took a ton of people in the community who helped me. Like this is real life stories from people being shared in this live chat. That's never lost on me. And I so appreciate people sharing their perspectives and their personal experiences. Jim says, to solve a problem as big as this, ministries have to work together, which does not happen as easily as we might assume. Christine says there are actually people that are dying of cancer that are living on the street. And if that doesn't horrify you, it ought to. She says, thanks to Dr. Boozary, I wish that everybody had his compassion and his drive to help. Emily G wants to give a shout out. She says, kudos to the ER staff at St. Mary's in Camrose. She says, for taking such amazing care of my mom on Sunday, as well as the EMTs. Emily, we're wishing you a positive outcome there. We love giving the shouts out, guys. You can send those in anytime, maybe as a positive reflection. We read those first episode of every week, presented by our friends at Solar by Kubi. If you've had a positive interaction, including, or maybe even most especially, in a healthcare facility like an ER or a hospital, let us know. I think that those frontline professionals deserve all the shouts out they can get. Let's turn the page here. We want to talk about recall legislation, and this is prompted by an interview that we did with Marg Tokar. Johnny, let's load up that short. Marg Tokar is the founder of AB Resistance, like Alberta Resistance, basically. Comes on the show, tells us that she's a lifelong conservative, but she's become disillusioned with this provincial government, with the Danielle Smith government in Alberta. And so she is not, while she's not kickstarting all of these recall petitions across the province, there's almost 30 of them. She says that her group, AB Resistance, is assisting recall petition organizers and helping them to understand the process or how to mobilize or get organized. It was an extended length interview. You can check it out in our podcast archive, or you can find it on our YouTube channel. But here's a quick synopsis of what she had to say.
We talked to people about their right to recall and what reasons they would use. Breach of trust was a huge one. And every single UCP MLA has breached the trust of their constituents.
You say breach of trust. I mean, that's a big deal.
There were campaign promises made that Albertans would never pay for health care. No one is ever going to touch the CPP. Smith spoke about not running on a Sovereignty Act. Bill 1, Sovereignty Act. And it's gone from there. And there's been no consultation with citizens. If that's not breach of trust, I don't know what is.
The 24 of them can send a message that they're somewhat frivolous. There weren't 24 drunk driving MLAs, or there weren't 24 MLAs accused of fraud or embezzlement, or there weren't 24 MLAs that haven't showed up for a single vote in the legislature. You're looking at me like I'm from another planet. But I think there's a lot of people that feel like the sheer number of these indicate that the process is being abused, that it's not a remarkable or standalone situation. Anybody can be targeted by these for any reason.
They can, but for good reason. It's a job evaluation, and they failed.
As a lifelong conservative, something obviously was awoken within you to start this movement that now counts 10,000 members. What's different about this government?
This is outright reversal of campaign promises. I think that's a little different. I want my children, my grandchildren, to grow up in the Alberta that I did, with public health care, with a fully funded public education system. And I'm paying attention. I'm paying attention every day. This is what I've been doing for 2 years, solid, daily.
That was Marg Tokar joining us on our January 20th episode if you want to check it out. It's titled Recall Petitions Target 26 Alberta MLAs. Well, it prompted a response on X, on Twitter, when we shared the highlight from Blaise Boehmer. He's a political strategist with a focus on political affairs and provincial affairs. He's previously worked with Jason Kenney as his DCOMs, his Director of Communications, prior to becoming the Premier of Alberta. Also worked in provincial governments under Premier Kenney in Alberta and Premier Bradwell in Saskatchewan. Blaise continues to be actively involved in conservative political circles and spends most of his free time trolling me on X and listening to obscure krautrock records. Welcome back to the show, Blaise.
Thanks for having me on, Ryan.
Yeah, this is an interesting scenario, not unprecedented. Politicians have seen recall initiatives before, but I don't know that there's any Canadian province or territory that's ever seen 24 of them at the same time. You think that this was a mistake from the very beginning. You don't like recall at all. We'll get into the history of it, but at surface level, present day in 2026, what do you think about what you're seeing?
I'll correct you there. It's not that I don't like recall at all. I think the legislation that we have now is flawed. And I think the genesis of the legislation came from an issue that Jason Kenney was having with his constituents, or with his caucus, and as I said in the post at the time, it was a sop to the people who were, fighting him over his leadership. So it was rushed out. I don't believe it went through the proper vetting process because it was rushed out. And what we're seeing today, when you go read the statements, like every recall petition has a statement indicating why they're seeking recall, and virtually every statement includes the use of the notwithstanding clause, which is entirely a legitimate activity of government to undertake. And so because of that, and because of the scope and the fact that it can be abused, I'm not going to say abuse. Marg, your previous guest, she's clearly passionate about politics in Alberta. She's organizing, she's using whatever democratic tools are made available to her, and I applaud that. However, I don't believe that it's a needless distraction, and I think it can be fixed by tightening the reason for the recall, like perhaps including something like an ethical lapse, but I don't think, quote, breach of trust is sufficient. That's why we have elections every 4 years. That is the appropriate time to evaluate the performance of your MLA.
What do you think would qualify as like an ethical lapse? Because, I mean, you, in so many ways, as breach of trust is subjective, so is ethical lapse. I mean, would you be looking for like criminal charges or an investigation, an internal investigation within the party, or what would qualify? Misuse
of taxpayer funds. I believe there was an MLA recalled, and the scenario was that this person was faking letters to the editor in support of the MLA. So basically, he came up with a phony name and kept writing letters to the editor supporting himself. So that's a breach of trust.
That's a ballsy move.
Yeah, it's deceptive. I'm not recommending that other people try that. That would be a good example. Maybe taking a holiday on taxpayer dime. There's a number of scenarios, but like performing legitimate duties as an elected official that you disagree with on policy is not sufficient, in my opinion. And that's sorry.
No, I'm sorry. You and I we haven't danced for a while. We're stepping on each other's toes a little bit. We'll figure it out. Super Chat Ken says, "Hey, not calling a public inquiry into the health scandal is an ethical lapse." I mean, would that qualify?
Sure. If like under the current legislation, you could file a recall petition under that. I don't think it's wise. I think if you disagree with this government, you should spend that energy on organizing for the next election. And like the most likely chance of success in this mass recall campaign was the Minister of Education. They came up 10,000 signatures short. I think that's significant. There's a lot of energy wasted on that. I believe in Shannon Phillips, former NDP cabinet minister. She encouraged folks to walk away from the recall campaign and put their energy into the next election. Shannon, if you didn't say that, I apologize, but I believe she did.
You described it in a post to me on X. You described the whole process as undemocratic, and that's where I disagree. I'll let people know, full disclosure, in this scenario is not my preference. I said as much to Marg, and it kind of, if you see her body language in the interview, she goes, ooh, like it kind of blew her back in her seat. I don't know if she was expecting it. But I just feel, and I said as much to her, that it kind of, I guess, almost cheapens it. It kind of like dilutes the power of it when everyone's being looped in. I mean, there's MLAs in there. I'm not endorsing any personal MLA, but like, I don't know what Nate Glubish did to be recalled in his riding. I see him as a particularly effective MLA and minister as an example. There's some that are being not recalled, but facing this recall initiative that maybe aren't my personal preference, but that's not what should drive recall. Like, that's what elections are for, where everyone can vote. So that's where I stand on it. However, it's definitely democratic. Like, they're utilizing law, they're utilizing options that were made available by the Alberta government by consecutive Conservative premiers, right? Like, do we agree there?
Yes. However, I would say it's anti-democratic insofar as it's not part of the Canadian democratic tradition. Yes, we have it here in Alberta. No, it's not a norm across the country. So that's as far as I'd say it's anti-democratic. The best opportunity to express your frustration and desire for change is not through a recall referendum, but through an election. And it's on the books. I think we've learned a lot from this, and I do hope the government goes back and rewrites this legislation. I don't think they can get rid of it. This has been a long-standing policy, I believe, of the Wild Rose. It was adopted by Jason Kenney when he became leader of the UCP, and it was implemented like halfway through COVID. Like, let's not forget how divisive COVID was for Premier Kenney's premiership.
Yeah.
So yes, I think it was born out of political desperation, and the result today we see is that it really took the government off track for this fall. The good news is they probably heard that their constituents are frustrated with some of the policies that they've been implementing. However, the citizens I think there's 6 recalls that have failed to meet, and they go, the timeline for completion goes well into May. It's unlikely that any of them will succeed. So these folks have been, they've stood up, they made their objection. We'll see what comes next.
Yeah, and I guess that's part of the beauty of it as well. And I guess that's part of the democratic process, is like, just because you can do something doesn't mean that you can do something. You know what I'm saying? Like, anybody can go. I mean, I guess people could probably start petitioning all of my sponsors to get me shut down. It doesn't mean it's going to work. I don't know why I shouldn't be planting these ideas in people's heads. But at the end of the day, if it doesn't work, it doesn't work, and everything worked the way it's supposed to work in a democracy, right? Like, there's interesting optics here. There's the optics around initiating the recall petitions. There's optics around whether or not they pass or fail. And there's definitely optics around a government changing the law to walk it back. Like, you've been director of communications for one of Canada's most well-known politicians. I mean, you've been in the game, a senior staffer. Talk to me about how you would manage the optics of walking back recall legislation without making it look like you're afraid of getting all your MLAs recalled.
You can't, if it's a bad policy, like I think walking back recall would be a bad policy. I don't think you can communicate your way out of it, despite what people think. Like the government was sweating for a bit this fall, understandably. But like, let's look at the process. Like, recall itself is a long, belabored process. You have to get the petition, you have to get the signatures, then you have to verify the signatures, and then there's a recall election. I think folks signed that thinking that signing the petition would in fact recall their MLA. That's not the case, because now you have to move to an election, and then you have to have a by-election to fill that MLA. So when you look at the whole package of recall, I don't believe it's it encourages responsible governance. And so, like, in principle, I think it's flawed. I think, however, the Premier Smith has always championed recall, so I don't think you're ever going to see it pulled back. There's a change in government, you could see that. However, anyone who comes along and tries to get rid of it, it'll be seen as self-serving.
Shauna in our live chat says, I see the recalls as organizing for the next election, as it will build the organizing muscles. Dubious wonders, what about treason? Is that something he thinks should warrant recalls? Sedition, is that something?
Those are criminal offenses.
Recalls?
So
those are criminal offenses.
I think you have bigger problems than recall.
I want to talk to you about Alberta separation in a bit. I want to talk to you about a couple of other things before I run out of time with you. But I would be grateful for like kind of a peek behind the curtain. Take us into that room. When your boss at that time, then the Premier of Alberta, was entertaining this idea, it was being presented to him. Is this something that, was there healthy debate in that office? Is that something that you were at the time speaking out against, saying, I think this is being rolled out too quickly. I don't think we're doing this right.
I don't want to tell too many tales out of school.
Oh, come on, Blaise.
It was a very top-down, panicky environment. The order came down, and as a dutiful staffer, your job is to implement the decision of the leader. Let's just say it was a very brief turnaround from the order to delivery.
That was very, very diplomatic. That was nothing. That wasn't even an amuse-bouche. That was nothing. Let me ask you about your take on what's happening in Alberta right now. Obviously, you're watching keenly, professionally and personally, I would imagine. Calgary's Big Four Centre was the latest location where hundreds of would-be separatists gathered to sign that petition. They're claiming that
they look like thousands. Not hundreds.
Oh, I just saw hundreds reported. Whatever it is, we'll see the tail of the tape. We'll see the numbers. I'm not trying to denigrate. Well, I am. I mean, I don't agree with the effort, but it is what it is. If there was 10,000, it was 10,000. We'll see. They claim the last number I saw released was just under 70,000. They need to get about 180,000 to trigger that referendum. My position, my guess, my crystal ball tells me there definitely will be a referendum on this year. Jeff Rath has been leading the charge on that, or at least has been one of the loudest voices. And in our most recent episode of the show, we were talking about an interview that he did where he stated that it would be easy to get have influence with other Canadian provinces as an independent Alberta, suggesting that with 70% of BC's goods flowing through the province, as an independent Alberta would inspect every train and truck for rats, says it could take months, says we'll tariff everything while it sits there, or give us a pipeline. He says that's leverage. Your former boss, Jason Kenney, describes it as, quote, more lunacy from Alberta's top separatists. Says he wants to landlock BC, throws in the clown emoji, by blocking every truck and train entering Alberta from BC for weeks. He says that's a recipe for economic chaos. And he goes on to describe and state what I think are pretty obvious but important points. Shortages of imports from Asia, blockades of goods headed to BC ports, possible force majeure by the feds, owner of TMX, to reduce oil shipments, jeopardizing up to $20 billion in Alberta exports. He says all of this would mark Alberta as a banana republic in the eyes of both importers and exporters, not to mention ruining countless businesses in Western Canada with whom we have no grievance. Describes it as weapons-grade stupidity and says we're way too smart to commit economic suicide. What do you make of the statement from Kenney? I'll note you're obviously not working in his office, not working for him anymore. And then just your general thoughts around the movement.
I think this clash is people getting ahead of their skis. There's quite a few steps to go. But I think the conversation is, descending into kind of calamity. We're facing a national unity crisis on two fronts, in Quebec and in Alberta and potentially Saskatchewan. The Prime Minister, he needs to get a handle on this. He needs to listen to Albertans. I think he's shown a willingness to do that with the MOU. I'm not optimistic about the MOU at all.
How come?
Because, there's just so many poison pills in there. And the comments from Cabinet after the MOU was issued showed that it's pretty clear that BC and First Nations will have veto over any potential project.
They say no veto. They say they'll be consulted, meaningful consultation, but they won't have a veto.
They've said both. That's not if you have cabinet ministers in the House of Commons saying the complete opposite. You have the energy minister say one thing, come back and reframe his thoughts. That doesn't inspire confidence at all. Premier Eby, he's unambiguous. Some First Nations, not all First Nations. I think it's unfair to paint all First Nations as anti-development. That's not true at all. I just don't see it. We see Premier Smith pushing back timelines. And I think, if we have a spring election, which is a definite possibility, that's going to mess with the Premier's timelines even further. So if we're looking at a potential vote in the fall of 2026, early spring 2027, there's not going to be much in that MOU to show Albertans that Canada is indeed working.
Blaise, just to clarify, you're talking if there's a federal election in the spring?
Correct. Correct.
Yeah. What do you think are the chances? It seems to me that the PMO is signaling that there won't. Who knows? Politicians have reversed course many times. They seem to be indicating that will not be the case. We'll see. I wouldn't be surprised. Do you think that there will be an early provincial election as well? Premier said no. She said no on this show. No. You're emphatically shaking your head.
I never bought that.
How come?
There's absolutely no reason. What's the point? There's absolutely no point. And especially with this secession issue hanging in the wind, it complicates things for the government. I think the Premier needs more time to make improvements on healthcare. As your previous guest demonstrated, things are not good there.
Yeah.
And there's. She has a majority government. There's absolutely no reason to call an early provincial election.
Now, you said that the Prime Minister, in the context of this separation movement in Alberta, you say the Prime Minister's got to get a handle on this. What about the Premier? What about Premier Smith?
The Premier, I think, she's in a tough spot. She's done a good job. She says repeatedly it's her job to make sure that Canada works, which is a significant shift in her position from when she first became Premier. She was very the Sovereignty Act was her first legislative move, and that was significant, and she had to water her wine to get caucus on side for that. Recall she had her 9 demands. She's kind of walked those back a bit to give Carney space to show that he is taking seriously what our issues are in Alberta. But recall the number one job of the Prime Minister is to maintain national unity. When provinces like Alberta and British Columbia have diverging interests, it's the job of the Prime Minister, and it's literally his legislative role to decide whether or not a pipeline goes through British Columbia. That's on him. That's with cabinet. That decision rests with cabinet. It always has, and it always should. So him giving de facto credence to provincial or First Nations veto over provincial or federally regulated energy projects is a major policy change from what we've seen before. And so he's got to make a decision. That's on him.
You mentioned Quebec and Alberta, and then you were like, and maybe Saskatchewan, and everyone's kind of going, wait a second, what? Scott Moe's trip to China with the Prime Minister was significant, obviously, and big for Saskatchewan producers, and including peas and canola and a bunch of other really important elements of Saskatchewan's economy. And Moe came back. I'm not going to say singing Carney's praises. That's
he did.
Not accurate. I mean, but like it was surprising, right?
He did.
Yeah. What did you make of that? And what do you mean by Saskatchewan? I don't see I feel like I spend way too much time online. I haven't seen anything credible regarding Saskatchewan separation. We asked Quick Dick McDick about it. He said that's not happening. He kind of laughed it off. But what do you mean?
Well, I think the challenge for Scott Moe's government is the split from the right that occurred under the last right before the last election. And right now you have a kind of offshoot of the Alberta Prosperity Project emerging in Saskatchewan, and they're doing grassroots meetings all across rural Saskatchewan. I would suggest that Saskatchewan is probably the most conservative province in the country. I just don't think it's good economically for the Prime Minister and Premier Moe to be on the same page, but I worry that there's going to be a fracture on the right in Saskatchewan, and it could take the form of a separatist movement. And if what's going on in Alberta is even marginally successful, that'll spill over into Saskatchewan.
I've professed my love for Saskatchewan, the wonderful memories we make in Saskatchewan. I mean, no disrespect to Saskatchewan, but Alberta and Saskatchewan are in, respectfully, entirely different worlds when it comes to natural resources and the like. I know someone will clap back to talk about potash and tell me that I'm underestimating Saskatchewan's economic potential, but the argument for Alberta's separation, as flawed as I think that it is predicated on a wealth of natural resources. Would you agree?
I mean, I haven't given much thought. I'm not going to say anything. I'm not.
You're not trying to pick fights with your conservative friends in Saskatchewan. I understand that, and I'm not either, which is why I say how much I love Saskatchewan, the land of living skies, and I love being out there for harvest and Thanksgiving, and Saskatchewan's wonderful, but Saskatchewan doesn't have hundreds of billions of barrels of crude and these. It
does have uranium. I think uranium is going to be incredibly valuable in the future, but I mean, it's not a recipient of equalization. The amount, when you do an analysis of what federal taxes are sent away versus what transfers are received, I'm sure there's some brilliant economists who can do that math. I don't want to get ahead and do the Jason Kenney, Jeffrey Rath, wish casting where they're imagining all these scenarios. But it's quite possible that Alberta and Saskatchewan could form a union. We're getting so far ahead of
ourselves. What's going to happen, Blaise? I'm going to tell you what's going to happen is that folks from the former Alberta are going to start bitching about the transfer payments they're sending to the folks from the former Saskatchewan. And then you're going to have the former Alberta separating from the former Saskatchewan from the new republic because none of these people are ever happy.
I don't no, I don't think that's true at all.
I'm gonna mark my words.
No. People have legitimate frustrations
Sure.
with how Canada is conducting itself, and we've had 10 years of anti-development federal legislation.
That's true.
And Prime Minister Carney still has not repealed those pieces of legislation. As so long as he will not do that, I mean, in fairness to him, he created a new law that allows him to circumvent existing laws. I believe it's Bill C5.
C5.
That's just not enough, because it's always temporary, at the whims of the current leadership of the day. Prime Minister Carney needs to show some true validation of the frustrations of Albertans by repealing these laws.
But what you mean by that, and correct me if I'm wrong, is that you want to see the Prime Minister, and I'm going to be candid and silly, but you want him to tell David Eby and Coastal First Nations to pounce. They're building a pipeline through wherever the hell they want it to go through to keep Alberta happy. Like in a summary, that's basically what it is.
I mean, not ramming through a pipeline, but like a pipeline that has gone through the appropriate approval process.
But that's
that has done the requisite work and saying, no, this is our federal jurisdiction. The final decision on a pipeline project rests with cabinet. We understand your objections. However, this is in the interest of the country. Yeah,
and I guess time will tell whether or not he does that, and whether or not he has the political fortitude to do it. Early signs may be encouraging.
My concern is we have this legislation that is designed to chill investment, so there will never be a proposal to do the pipeline in the first place.
I mean, you would hope that the Alberta government, in negotiating this and providing the list of the 9 demands to the federal government and signing that MOU, at least has some belief that there could be some partner. I don't know that anybody has an appetite, including ardent conservatives, to see the government foot the bill for another pipeline. And
that's part of the MOU. It's like one of the first bullets. It has to be privately, and I refuse to have any public money towards a pipeline. You should not be losing money selling energy.
I think
it's ridiculous
when you put it like that. And I think that's somewhere where everybody can agree, is that the government should not be footing the bill on this. Let me ask you, and I want to thank you for your time. We've taken you into overtime here, but I got to ask you about Pierre Poilievre. Obviously, if we're talking Carney, we should be talking about the alternative perspective, the alternative approach, and how Mr. Poilievre would approach Alberta separation, and Quebec for that matter. Although I treat them like two different files. There's a common theme, but two very different files. Are you going to be down at CBC convention in Calgary this weekend?
I'm still thinking about
deciding. Okay. Well, what are you going to be looking for? Obviously, people, I think that he's going to, I don't know if I say flying colors, but I think he'll maintain the confidence of party members. But it's not without its bumps in the road. There, new polling's out. We've discussed it on the show that shows that his popularity ratings have not improved at all in the last 18 months. How much of a problem is that? And what are you going to be keeping an eye on?
I don't think we'll see what the most interesting dynamic is, which is to what degree Alberta conservatives have jumped on the secession train, so to speak, and how much faith they've lost in federal politics altogether. And we won't see that at convention, I don't think. I think he'll sail through. I think he'll get Stalin level approval numbers. And it's going to be your typical, media cycle of look at what this crazy conservative guy said. Poilievre, do you support that? The usual gotcha kind of jumbo.
What do they call those again when they go to the floor and the delegates can table, not members' initiatives, or I'm drawing a blank.
Constituency resolutions,
right? The resolutions, policy resolutions.
Yeah. And I think it's going to be a good party for conservatives. Conservatives like Poilievre. They love him. He's he's firm, he's principled, all the things that that conservatives like about him apparently turns off people in Ontario. So that's going to be the challenge for Mr. Poilievre going forward.
Maybe I'm not going to say too principled, because that sounds like a real compliment. But maybe when you say firm and principled, in the spirit of sticking to his guns, is that maybe part of his problem? Do you think, like an inflexibility on the presentation side? Have you ever worked, like you were director of communications with Kenney? Like, have you worked, and you've worked in Saskatchewan as well with Premier Wall? Have you ever worked with a politician on a public makeover, so to speak? I'm not talking physicality, but just
no.
It's you think it's possible? Like, have you seen a successful one?
No, I can't think of one. It's so transparent if and when it happens. I don't think it works on folks, and I don't think the win for Poilievre lies in a makeover. I think if he abandons what I described as firm and principled, I think he loses his base by transferring to that. And that's really kind of like the problem that he's facing. Like what I'm seeing is, with Prime Minister Carney, he's speaking out of both sides of his mouth, and yet that doesn't hurt him at all. I don't understand Ontario. This is why I stick to Alberta and kind of mind my own business in Alberta, because I don't understand what moves voters there, and I wouldn't pretend to.
We've been hanging out with Blaise Boehmer, former senior staffer for both premiers Brad Wall in Saskatchewan, Jason Kenney in Alberta. Now, of course, working as a political strategist focusing on provincial affairs. Two things, housekeeping, orders of housekeeping. Here's a photo courtesy of the CBC from the Big Four down on the Stampede grounds in Calgary. They're estimating the attendance at 3,000 people for that Alberta separation rally. Of course, the petition gathering signatures for their petition. So there's that from a fact-based perspective. They say another 1,000 joined the live stream. And MetaModern in our live chat has kicked $5 into our YouTube super chat to make sure I ask you this question. We've saved it till the end for good reason, because it's unrelated to anything and it's very niche. Johnny,
Is it Krautrock?
Well, it's affiliated. It's adjacent to Krautrock. If you could take the wide shot with Blaise, we want to see your background there. MetaModern says, is Blaise an audiophile like me? He says it looks like he has Fostex headphones in the back. He says the Apple cans he's wearing are no joke. What's his favorite headphone?
Ooh, that's a tough one. Those aren't Fostex back there. They're Écoutez, and they have a nanotube in them, so you get digital with tube preamp, which is delicious. Best headphones, probably Focal Stellia. Yeah, that would definitely be it.
Okay, and for those of us that have no idea what the fuck you're talking about, what is the most, this is so rude, what is the most you've ever spent on headphones, and what is the most you would spend on headphones? And what is the most you can spend on headphones?
Oh, you can spend, I've seen $60,000. You can spend up to $60,000. Yeah.
And what's the most you've spent?
I wouldn't recommend it.
What's the most you've spent?
Probably like $2,100. $2,100. But I don't. Yeah. Totally worth it. I spend a lot of time listening to music.
Okay. Thanks for doing the interview, Blaise. It's good to see your face again.
Thanks, Ryan.
Yeah, I'll let people know that you and I remind each other of the value Blaise and I do of connecting in person and talking in real life and going for beers. And it's nice to see you here as opposed to just on X, where we duel and thrust and parry, all in the spirit of improving political discourse in the province. What is the most that you would ever spend? You're kind of my authority. Josh Dunford, who's our executive producer, is an audiophile. He's out in Vancouver. You're here. What's the most you've ever spent on headphones, and what's the most you would spend on headphones?
Oh, God. Not 2100. That's did he say 2100?
2100.
Yeah, I don't know. Back in the day, I used to care a lot more about headphones, but now when I DJ, I don't even use headphones anymore.
Oh, is that right?
Yeah, because DJing's a lot more visual now, right? You look at a computer screen, you can see the wavelengths. Plus, I'm already so just used to mixing. I mean, I may just grab some headphones just to hear, like if it's not a song I've never heard, just to hear the intro, but like I know timing, I know tempo, I'm good. But I back in the day, I would have spent like $750. Nowadays, like these ones I've got on, about $200.
Okay.
You still want to be above, like I would tell anyone who wants to hear, music, audio, podcast, whatever it is at a good level, you're not going to get that with like $50 earbuds or $100 over the head cans off Amazon.
I think for a lot of people,
you need to spend like $150 to $200, and in that range is every, like, you've got stuff with deep bass, you've got stuff that's flat, you've got stuff that, if you listen to opera, the mids are higher. You can find a great one in the $150 to $200 range.
It's probably the same as sunglasses, where there's people that spend like $5,000, $6,000, $7,000, $1,500 on sunglasses.
I don't.
And then there's the gas station
like $40 because I lose them every weekend.
That's what it's people that are always losing or sitting on their sunglasses that have finally gone now to the like $30 or less.
Yeah.
Speaking of Les says in here that he says, what did he say? $10 on Temu for headphones. Hollis says the best headphones for sports are the Shocks open ears, $200, and so great. Tony says that she gasped when she spent $150 on her Beats headphones. She says rose gold, and they are lovely. Tony, my wife Carrie, wants anything rose gold, so I might have to send you a message, see if I can hook those up for her birthday party. She's not listening, don't worry. Erin says that her kid is at NAIT doing media and communications. Good luck to him, Erin. Says used to be the TV and radio program. I'm the graduate of the SAIT version of that. She says the tech is a super big deal. Of course it is. And Vamp Fashion says we had a family friend who finally reached his limit of speaker cables that cost $25,000, not including the speakers.
Okay, so this whole audio cable
that's insane
thing has just taken off in the last 5 to 10 years. It was always a big thing, but our friend Josh from BC, he's making his own cables. I know tons of DJs who make their own cables or go to electricians or to audio, Long McQuaid or whatever, find people and get them to make their own cables. It's absolutely insane. I love this, though. This is a throwback to remember when you used to build your own sound system at home, get the speakers, and everything was everyone's system was custom. You go somewhere, you'd be like, I have that amp, CD
that
player
preamp,
or that amp, but
receiver.
you have the different you get a different sound in everyone's home. Now you go to everyone's home and it's like, the Amazon or the Echo Dot is there, the Apple, whatever, Google Home is sitting there. It all sounds the same where you go, anywhere you go now.
MetaModern, I'm glad you got your money's worth for the $5 on the super chat for the answer. Says, ooh, Earmuffs Kid says, ooh, fancy as fuck. And then just says, my man. I love, even though I understand nothing about this, I'll tell you guys a little peek behind the curtain. I spent, what were those headphones that I bought? Nicest ones I bought. I think they're about
this is a great story.
$400. I think they were $450.
What happened?
It's a business expense. It's a work expense, right? I wear them every single day. Had them for 3 weeks, and they were stolen during our Real Talk holiday party.
Let's just say
stolen.
We've said this before. Let's say misplaced, because we might open a drawer or a cupboard a month from now, and there they are. Or here's what I think, and I know this might be it. We were doing a lot of Christmas moving in and out with boxes and things and cables and whatnot.
I like that you're holding out hope we're going to find
I
them.
think it's in our storage closet back here. You can't see it, but it's right here, folks. There's a storage closet packed with cables.
I'll tell you
and
what,
lights.
if
and
we find them,
I think it's back there.
If we find them, I'll walk it back.
I think somebody.
But as of right now, I'm shocked and stunned at the 3 weeks that I had. I started to. They just felt so good. They looked so good.
They did look great. I'm going to take responsibility and say I probably threw them up on a top shelf, and they're
Maybe we'll find them today.
They've fallen back in like a crack.
I recognize, guys, that we could be talking about like Notwithstanding Claus and Pierre Poilievre and Danielle Smith and Saskatchewan separation. What? And a million other things. We could talk about the housing conversation with Dr. Andrew Boozary, but every once in a while, just for like a few minutes, isn't it nice to just everybody here? I think that there's conservatives, liberals, and NDP supporters all talking about headphones in our live chat right now, and nobody's telling each other to screw off. So this is beautiful. MetaModern says, this conversation is right up my alley. Michael bought JBL earbuds, says they were on sale after Christmas. Best purchase in a long time. Ambient sound, noise cancellation, so wonderful to finally have as options. Pretty excited about that. Matthew says he'll never give up his Bose. Are they called the QC2?
Oh, those,
Matthew?
Yeah, those
Bose
are
QC2 headphones. Says they're the best noise canceling headphones I could find, but they're not made anymore. The replacement model's worse. He says I got aftermarket replacement headbands now. And Justin went for a beer with Justin last night. More on that in a minute. What a beauty. Just an incredible real talker. Says he loves his Google Pixel Earbuds Pro. Says those are $250. Says he has an over-the-ear set of Sonos headphones for $500. Says he uses those with his sound system or travel for the best noise cancellation.
Yeah, and don't be afraid of brand names. Like people, you hear Google or you hear Apple earbuds. Man, my Apple earbuds, my Pros, I mean, I can't talk bad about them. They're generic, made for everyone, mostly flat, little bit of bass boost there you can hear and a little bit of mid boost, but like for the most part flat earbuds. But man, you have them too, and I showed you how to like selectively make them like you walk outside and it cancels the traffic.
It's brilliant.
And then somebody walks up to you on the street and it brings in their voice, turns down your music. It's absolutely insane, the tech today.
Ken K says one of the owners at National Audio is telling me about audio cables that are $500 plus per foot. People
are obsessed with cables.
Plain Power says I was totally satisfied with the old yellow Sony Walkman. Remember the Sport?
That was the one.
It was like the Sport though. It said Sport on it, and and then the yellow Discman came out, and you were just like,
and it had the headphones like this that went in.
Oh, they were so.
And everybody you'd see when it would rain, people would be walking outside with them because it was waterproof, and they're in the rain.
Best. I was like, I couldn't wait to wear mine. And to rock it at high school, but I was also aware the whole time it was probably going to be stolen. You know what I mean? Like that was just kind of where it was, where they were with on demand. By the way, MetaModern, who kicked off this whole conversation about headphones, way to go. Just commandeered the whole show for 15 minutes, MetaModern. Congratulations.
I wonder who's listening right now.
I daily drive some Hi-Fi Man Aria Stealths. They are $1,700 US. With new, are they called planar drivers? Sorry if I'm screwing this up. Says, thank you so much for sharing these details with us, says MetaModern. So there you go.
I wonder who's listening right now. Audiophiles listening in their headphones right now to our voices.
Should we give them something good?
I don't want to give you.
How does it sound when we drop it down here?
We go high and low.
Hey, and for those that are watching, if you like the threads that I'm rocking, why don't I tell you where I found them? You know, when I need to look good on camera or on stage, like this weekend at Chamber Ball, what an incredible celebration that was. I go to the Helm, a fantastic 3-story retail experience, 1 block from our studio in the historic Mercer Warehouse. They're a block away, just south of Ice District, and they have just put together an incredible, like we said, a retail shopping experience. But I also want to point out what they have going online at thehelmclothing.com. Right now, they have their Damaskina Made to Measure event, and it continues for the next few days. This is the most exclusive menswear brand in the market. Step into luxury with custom Damaskina suits, sport coats, dress pants, and outerwear. This is by appointment only. You can book your appointment with founder Chad Helm and his team by visiting the website, thehelmclothing.com. I do want to remind you, if you are shopping the Helm online, everything from luxury custom casual wear all the way up to custom suits. The promo code REALTALK, all one word, is going to knock 10% off your order. That's a big deal. The promo code is REALTALK, all one word, at thehelmclothing.com. You're invited to join us at You Can Comedy Nights coming up through March. So much fun. This is an annual tradition for my friends and myself. We get a table for 10 at Rick Bronson's comic strip. We listen to comedians, have a ton of fun. laughing all the way through, and we know that every single dollar that we're contributing is going to an incredible cause with great impact, and that is UCAN Youth Services. We talk a lot about UCAN and how proud we are to support them because of the proof of their performance, helping young adults out of harm's way and onto paths of economic independence. They're creating confidence by manifesting employment opportunities. You can learn more about it at ucan.ca. Don't forget, UCAN Comedy Nights run March 9th to the 11th, March 16th to the 18th. You can get your tickets today, again, at ucan.ca. Our friends at California Closets, without a doubt, the best in the business when it comes to custom closets and storage solutions for your entire home. You know, if you need a custom closet, you haven't been able to find your dress shoes for a couple of months now. You have no idea where your favorite shirt is. And never mind the fact, cufflinks, where are those cufflinks? You don't know. You need a California Closet. It has totally transformed the organization in our home, and we have the confidence that this installation built in Alberta by this Canadian-owned company is guaranteed for life. California Closets can custom design anything to fit your space and your budget. It starts with a risk-free, free consultation, and you can book that today at californiaclosets.ca. And our friends at North Road Investment Council reminding you that it's always a good time of year for you to check in on how your investment strategy is going, what your retirement strategy is looking like. We heard from an incredible real talker by the name of Michael, who told us that he was going to be booking a consultation at North Road Investment Council. I asked him to report back to us, and we just got this email from real talker Michael, who says their front admin warmly greeted me by my first name when I walked in, he said, which was a great start. Then Marshall, who I had previously seen on Real Talk, appeared welcoming me to his office to introduce his associate, Corey, who was just on the show last week, says they both met with me. The chat was relaxed but super professional. They weren't pushy, but they of course promoted the value of their services. Michael said, I explained I wanted to remain in the driver's seat, not hand off the keys for investing. They said they're uniquely set up to do exactly that. Consulting, coaching, modeling for the future. That's what they specialize in. Marshall and Carrie walked me through my current portfolio. They offered encouragement that I had managed well, but also pointed out some blind spots that I had. For example, I thought I was well diversified because I have a variety of sectors in Canadian and U.S. shares, EFTs, but Marshall gently pointed out the worldwide markets I needed exposure to in order to truly be diversified. All in a valuable conversation. I will be taking a step further with North Road after developing this trust that they truly know what they're doing. That's a real email from Real Talker Michael into talk@ryanjesperson.com. His personal experience checking in with Carrie Williams, Marshall McAllister at North Road Investment Council. You can connect with them today by visiting northroadic.com. Always love the real life testimonials from real talkers that have gone out, taken our word for it, you know, and checked out these sponsors, these Real Talk partners that do truly an incredible job and have a wonderful experience. That's great for us, and we sure appreciate you, Michael, taking the time to share that. You'll remember Cassandra had posted in our live chat earlier in the show, and she had shared something pretty significant, said that she had found herself basically on kind of on the precipice of homelessness. She basically said that, you know, within the last 3 years, it's been a real battle for her. Yeah. And then she said, you know, with the government cutting back my pay, she said, you know, basically that it's sort of a perilous circumstance. I'm paraphrasing, but we invited her to send more information, further details, and she did so, Cassandra, and I wanted you to know that I saw that. She says, I live with severe disabilities, and I am on AISH. For those of you that are listening, maybe from Ontario, BC, outside of Alberta, that's the Assured Income for the Severely Handicapped. It's Alberta's provincial program. It says they just started deducting $200 per month from AISH. That's the provincial government in Alberta. It's the only province that's doing this, by the way, that's clawing back the federal disability benefit. It's $200 a month. It's like the cheapest pettiest move you've ever seen in your life, clawing back $200 from AISH recipients that are receiving, and I hesitate to throw numbers out there because I think that there's different levels of AISH, and I don't know that everyone's the same, but last I've heard it's approximately like between $1,500 and $1,700 a month. If you can imagine, I talked to somebody that stopped me on the street the other day, as a matter of fact, on the sidewalk, a real talker that is a recipient of AISH, that let us know that they're receiving $1,700 a month, and $1,400 of that is going to their housing program, leaving them $300 a month for everything else, if you can imagine. Trying to have the basic stuff, like a communications tool, like a phone, so you can communicate with people or receive news or do your online banking. Everything's online now. It's essentially a necessity, isn't it? Can we all agree? Imagine having to make do for everything that you need outside of housing on $300 a month. I appreciate that real talker. That was Mike, by the way, that shared that with me. Mike, I'll never forget our conversation. Cassandra says they started deducting $200 a month from AISH, and in July they kicked me onto ADAP or ADAP, and I'm going to lose another $200 a month in income. She goes on to say, I do have skills from past careers, but I need accommodations and I need an assessment to see what accessibility tech I need and what funding I have available for that tech to be able to return to meaningful employment. That from Cassandra. This is real life stuff, man. And I appreciate you sharing, Cassandra. It's never lost on me that no matter what we're talking about on this show, there are going to be people not only that can relate, but people that are walking miles in the shoes that we're talking about, people that have lived experience and a true understanding of the impact of things like government policies, funding initiatives, funding shortfalls, and the like. And I know that that's a big part. We want to say it out loud. That's a big part of what drives us here.
Yeah.
I did want to mention, I had a chance before we wrap here to check in with a couple of pretty incredible real talkers, Darren and Justin. You see both of them in our live chat on a relatively regular basis, and they're huge contributors to our Real Talk community chat. This is the Real Talk channel on Discord. It's something that we've rolled out in recent months as an added incentive for our Real Talk Patreon supporters and those of you that support us with a YouTube channel membership. And that's basically a live chat. It's more than this, but a live chat that can go 24 hours a day. And Real Talkers can connect and share stories, share photos, share their thoughts on different issues. And I just wanted to credit Justin and Darren. They sat with me at Arcadia Brewing Company last night for an hour and a half, and we mapped out our plan for the Real Talk community chat on Discord and how we can improve it and how we can make it a better user experience. And these two are volunteering to step up as our moderators, and they're going to be working, Johnny, with you and me to make that experience better.
Amazing.
So isn't that cool?
Can you do the YouTube chat too, please?
Hey, while you're at it,
Jesus.
we might have to bring them in on a full-time position. Yeah, the job's 14 hours a day, 7 days a week.
And lots of stress, one free therapy visit a month.
Yeah, and we'll buy your beers at Arcadia or in the Real Talk beer fridge as funded by our incredible Super Chat supporters. We appreciate you, Super Chat Ken, as well. We saw you in there with your $5 as great guests today, and a shout out to Johnny for exhibiting so much patience. But a big shout out to Justin and Darren for taking the time. We appreciate it, and we wanted to give this heads up as we wrap today, just to let those of you know that support us on Patreon, our YouTube channel members, that if you haven't yet joined the Discord, make sure you do so. If you've not yet received the link, we try to make sure that it's out there and available to you all the time. You can always send us a note to talk@ryanjesperson.com, and keep an eye out for improvements there. We want the user experience to be top-notch as we continue to grow this show. We can't grow the show without you. That's a fact. And so thanks to everybody that tells your friends about the Blaise interview or the Dr. Boozary interview, that likes and subscribes to our YouTube channel, that shares it with your friends. We'll be back at it again tomorrow. Send us an email anytime. One love, everybody. Chat soon.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton, member emerita Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.